2 more, come on. Yeah, we're lifting this whole gym.
All right.
Again?
Yeah. Oh my God.
Hi, I'm Dr. Oligodendrocyte, but you can call me Dr. O.
Sounds good.
Alrighty, so what's the problem?
Well, I'm having some really bad muscle pain and soreness, and I have bruising in the area that has been bothering me, and my pee's kind of discolored.
Okay, how long has it been since the injury happened?
It's been a couple days.
A couple days. And you said you were lifting when it was?
Yes.
Was it a bench press?
Yes.
Okay. How frequently do you lift?
I don't.
Never?
Never.
Okay.
Just trying to get some
One-time
gains.
thing?
Yeah.
Okay. So, how intense was your workout, and did you take enough breaks?
It was pretty intense, and I don't take breaks.
Never?
No.
Oh my goodness. Okay, so it's definitely important that you let your muscles recover by taking breaks in between workouts. And did you stay hydrated during your workout?
No, I don't drink much water.
None? Okay. Do you have any nausea, vomiting, or discomfort along with your other symptoms?
Discomfort, yeah, in the area, but
Okay.
some nausea, but no vomiting.
No vomiting. Have you ever experienced an injury of this kind before?
Nope.
Okay. So basically, it sounds like it was just an overexertion injury, and I have to emphasize the importance of taking enough breaks and staying hydrated during your workout to let your muscles recover. And so let's take a urine test to see what's going on. Alrighty. So the urine test showed increased levels of myoglobin and hemoglobin, which leads me to believe that you have a mild case of rhabdomyolysis. Rhabdo is a condition where your skeletal muscle breaks down, and in your case it's due to overexertion. Mainly what you should do to prevent this in the future is taking adequate breaks during your exercise and hydrating adequately.
Oh.
Dude, are you okay? Hi.
Hello.
How are you?
Good. Well,
Not so good. I'm Dr. Oligodendrocyte. You can call me Dr. O though.
Nice to meet you.
So tell me what's going on.
So, a few days ago, my buddies and I were just kind of messing around, and I got trapped under some rocks.
Okay.
Yeah, for a little bit.
So like big rocks?
Yeah, they were pretty big, like boulders.
Okay. So what symptoms are you experiencing?
Well, my back has been like pretty tender, you know, right about just basically everywhere where I was kind of trapped under the rocks.
Okay.
And
can you point to exactly where the pain is?
all up in here, you know.
Okay.
All around.
Okay.
Just kinda on the same spot, both sides.
Both sides.
Mhm.
All right. Any other symptoms?
Yeah, my back has been really tender all day and it's starting to bruise up
Okay.
a lot. And my pee has also been really a lot darker,
Okay.
kind of a weird color.
Any swelling?
Yeah, a little bit, not obnoxious.
Okay.
But,
Do you have any nausea, vomiting, discomfort, or confusion?
well, I did throw up quite a bit right
Okay.
after it happened.
Okay.
And then the past few days, I've been kind of hazy, just kind of dazed,
Okay.
glazing over,
All right. Well, let's take your blood, and then we'll do a blood test to see what's going on.
Okay. Hello.
Hello. So, the blood work shows increased levels of creatine kinase and potassium, and
Okay.
so for that reason, we think that you have rhabdomyolysis. And rhabdo is a condition where the skeletal muscle breaks down, and in your case, it's due to crush injury. So treatment, you should make sure you hydrate adequately and get some rest.
Okay.
And if things don't get better after a week, maybe longer, you should go to the ER because at that point it could be severe kidney damage.
Oh wow.
Yeah.
Okay.
Especially in rhabdomyolysis. And from what I've seen and what I've heard, it seems as though this is what you're suffering from. Rhabdomyolysis is a breakdown of skeletal muscle tissue, which is releasing myoglobin, an oxygen-binding protein. This myoglobin is being released into the bloodstream and eventually finding its way to the kidney, where it might be causing kidney failure dependent upon the levels of which the myoglobin is found inside of your kidneys and the bloodstream. Any of the signs and symptoms that you may be experiencing can range from muscle pain and weakness to an edema of the muscle or the joints. Tea-colored urine also can commonly be found as a sign of kidney failure. The causes of rhabdomyolysis can vary. Common causes are injuries in which the muscle is crushed in a car accident, for example, or in a collision during a sporting event such as soccer or football. Regular gym goers can also suffer from this disease if they are overexerting themselves during a prolonged exercise bouts, without proper hydration and consumption of food during their exercise. Some medications are also known to have rhabdomyolysis as a side effect, and if you fall into this category, then you should stop taking the medication immediately and consult with your doctor. Rare causes are insect bites and snake bites due to the toxins that they release in the venom. What could have caused you to develop rhabdomyolysis, we need to discuss exactly what is occurring within your body. Rhabdomyolysis is the injury to muscle cells resulting in the leaking of lactic acids as well as other organic acids into the bloodstream. This overabundance of acids into the circulatory system can lead to metabolic acidosis, electrolyte imbalances, blood clotting disorders, and potentially kidney failure or injury. Treatment. Our most crucial goal is to preserve renal function so blood may continue to be filtered and cleansed. This may be achieved through the patient undergoing dialysis treatment, which will be necessary only if the disease has progressed to the point at which the kidneys are no longer able to function properly. The exact treatment for rhabdomyolysis depends on the specific complications that are occurring within each patient. Early stages can be treated through intense fluid replacement, orally or through an IV, in order to reduce the risk of this kidney damage, as well as a break from exercise or unnecessary stress. This is used to further limit the release of myoglobin into the bloodstream. From occurring in the first place, it is important to follow these guidelines. However, these guidelines will not aid if the disease has been caused by a crush injury, medication, or toxin from a snake or insect bite. You need to limit the consumption of alcohol and use of drugs without doctor supervision. These drugs are specifically talking about narcotics of which you have not been prescribed or are illicit drugs. Drink a healthy amount of water daily, at least 12 cups for women and 15 cups for men. This is the bare minimum. If you are partaking in regular physical activity, then you should be drinking. You need to monitor fluid intake during and after exercise in order to flush out any myoglobin that has been released and to ensure that you are staying hydrated. You also should exercise regularly and supply the body with necessary nutrients following said exercise. Thank you.
Thank you.
Thank you.